Hi guys, Dr. Oley here. I'm here to chat with you a little bit about osteoporosis. I'm one of the interventional pain physicians with OrthoVirginia at the Parham location. So you guys probably have heard of osteoporosis maybe from your doctor and the media. Maybe you're not really sure why it's important or what's the significance of it. So let's start by just talking about what is osteoporosis. So osteoporosis is poor bone health or weakening the bone, resulting in fragile bone. And why is that important? It's important because if you have weak bones, you can suffer from something called a fragility fracture. And a fragility fracture is just that. It's a fracture that occurs usually in the spine or sometimes in the hip. There's obviously other areas of the body as well, but most commonly what I see is fractures in the back that occur from minor trauma that typically wouldn't result in a fracture otherwise. For example, I had a lady in clinic the other day that came in saying she lifted up her granddaughter, and then the simple act of bending over into the crib, lifting up the baby, resulted in a pop in her back and severe debilitating pain. She ended up ultimately having a vertebral body compression fracture from the simple activity of lifting up her grandson. So the big takeaway message is that these fractures can occur due to poor bone health, right? So what are the options to treat these fractures if they occur? So one of them is something called a kyphoplasty procedure. That's a procedure that I perform, and what it really is and what it's about is if you have a vertebral body compression fracture, this can occur in this area. So this is called the vertebral body. The bone is soft, and if a fracture occurs, there can actually be height loss of this vertebral body. So one thing we can do to help with that is a fracture does occur is we can go through this bone here, the pedicle, and then go into the vertebral body, balloon it, and put cement in that area. And it's great because it does help with pain. The main thing that I talk to my patients about, and the reason I'm doing this video today is that while these procedures are important, the most important part of this care is making sure that you're getting diagnosed appropriately with osteoporosis and being treated. It'd be similar to going to a cardiologist and getting a stent done, but not having, the appropriate diet and the appropriate medications ordered. So my main focus today is to talk about the underlying treatment for osteoporosis and how do we get screened for it. So what I generally tell people if they do come into my office with a vertebral body compression fracture is that while we can do the kyphoplasty, I really want you to get screened for osteoporosis. So the most important screening test that we can do is something called a DEXA scan. Okay, DEXA scan looks at the overall bone health and quality. And who needs a DEXA scan? Well, that's a good question. We have different screening algorithms and different processes in place to see who needs to actually get screened. One of those is any female over the age of 65 should undergo screening for osteoporosis with a DEXA scan or whatever test that is appropriate. There's also postmenopausal females less than 65 with risk factors. What are those risk factors? There's a whole list of risk factors, but the most common ones we come across are people with previous fragility fractures, family history, alcohol use, smoking use, and there's a couple of other ones on there that, depending on your race and gender, those are all important factors that go into whether you need to be screened for it. So ultimately, once you undergo screening, it's important to talk to your primary care doctor about potential medical management, right? So we want to make sure people are being treated appropriately, and there's a number of different medications out there appropriate for treating osteoporosis. So the main takeaway message from today is to go and ask your doctor about screening for osteoporosis. Are you an appropriate candidate to undergo a DEXA scan? And then if you ultimately do get those results and you do have osteoporosis, going about seeking treatment for that, because unfortunately having untreated osteoporosis can ultimately lead to these fractures that while we have options for them, we want to make sure that you're being treated medically for them to prevent future fractures. Thank you.